Hi everyone, it's Jacob here, one of the co-founders of accuRx. Thanks very much for joining us this afternoon. I'm sure your practices are all incredibly busy, so we really appreciate you all taking the time. As you've probably learned over the last 24 hours, we've been working quite hard to try and get practices solutions to both respond to patients with potential coronavirus, but also to maintain routine services whilst keeping their staff and patients safe. Those two main features have come from what practices were asking for, so a way to screen patients who've got a booked face-to-face appointment before they come into the surgery. And we'll give an example of that, the COVID-19 Florey screening questionnaire. And then the other thing we've been working on is a way to perform consultations over video without needing webcams in your practice or without needing patients to download an app or anything like that. So we'll also give a demo of that later on this webinar and then open up for questions. I'm sure there'll be many, quite a few of them are covered on the support section of our website. So do also please have a look there. So I'm going to pass over.
Hello, everyone. So I'm going to be demoing our new Florey survey for triaging face-to-face patients who have booked in for appointments. So what you can see now on the screen is the typical Amos web flow with here the accuRx toolbar on the side. So we click send a message to the patient. We click on Florey, which is where all of the structured questionnaires are stored. And then from there, we can select the COVID-19 triaging questionnaire. So this pre-fills text. You can edit this text if you would like to have any specific information from your practice for that patient. And then usually the patient's phone number does pull through from the medical record, but if not, you can type it in like so. Oh, this patient is already enrolled. That means that currently our system blocks any patient from receiving multiple questionnaires of the same one had they not received one. This is so that we don't end up spamming patients with the same thing over and over again. And here we should be able to pull through a new patient instead that is not enrolled. One moment, there we go. Yep, so in the same thing, we go to Florey, select COVID-19 triaging questionnaire, put in a mobile number if it doesn't pull through, and then should be able to send that to the patient. There's quite a moment loading here because we're still pulling through the consent codes to ensure that we can send, and this patient has opted in, so we can go ahead and send that. The patient will receive this as an SMS message. You can see a preview of what that SMS message looks. And they at the bottom here have the link that they're going to follow. Just a demo on the computer here. We'll just copy that link over to a browser so that you can see what that looks like. Okay. Sorry, just getting the copy and paste set up here. So when the patient receives their SMS, they can click on that link. They receive a message here about what is going on with the survey and how it is operated. So, hi Lisa, which is the patient's name. Due to the current concern of the spread of coronavirus and under guidance of Public Health England, we are screening patients before they come into the practice. If you do not complete this questionnaire, your appointment may be canceled until we assess your risk. And the survey is operated by accuRx. The link here is for our privacy policy in case the patient is interested in reading more about our Gdpr compliance, and then ask if they are happy to proceed. So the patient would press yes. They would need to accurately enter their date of birth. This is how we verify that the correct questionnaire has come to the correct patient so that when the practice gets the response back, it's correctly coded. If the patient incorrectly puts in the date of birth 15 times, the survey is locked and can no longer be used. So we would press next on that. The first question is, have you traveled outside the UK in the last 14 days? So if you press yes, The next question would be, where have you traveled, and to please list the specific region. So maybe they can say they've been to Paris in France. They would click next. Has someone who has tested positive, i.e. a confirmed case of coronavirus, been in close contact with you? Close contact means living in the same house with someone who is self-isolating on NHS 111 advice. Face-to-face contact, for example, talking for more than a few minutes, being coughed on, being within 2 meters of the person for more than 15 minutes, or contact with their body fluids. So the patient would answer yes or no to that question. And the last question is, do you have any of the following: cough, fever, or shortness of breath? So they can answer yes or no to that one as well. After they complete the questionnaire, they submit the answers. They can go back and review them if they prefer, but they can submit that way. And they're given this screen to thank them for completing the answers, and then also what to do if they do suspect that they could be at risk for coronavirus. That response then comes back into your accuRx toolbar via the notification icon that comes up on your initials. There might just be a loading going on for a moment here. I believe we have some examples. I think there's just a moment delay while it loads, but what the response looks like is this example here, where it comes in from the accuRx bot. It says the patient name and what questionnaire they have completed, confirms their date of birth, if they have traveled outside of UK or not. If they have selected no, then there's no locations answer, and then contact with confirmed cases, yes or no, and symptoms, yes or no. So this can be clicked save to record, and it will connect to the patient's medical record and come up and displayed. I think because this is a dummy patient, we might have a loading issue just because it's, yeah, but here you can see an example of one that has been correctly saved to the record. And you can see that it's lists that it's been saved to the record. So that's just kind of a quick demo of how the Florey survey for coronavirus triaging works. If you have any questions, please do write in our chat, and our support can help answer. Oh, there's a really handy feature that we have as well. We just had a little water accident go on here. There's a very handy feature that we wanted to just bring notice to, that when you come into the different teams, there's a archive button here. So if you press on that archive, it will go into a separate folder so that you can see that message has been actioned. If you want to review any of your archived, there's a little toggle down where you can see the archived box, and then you can see that message is still available there if you need to go back to it for any reason. Yep, so that's it for me now. I'm going to pass you over to Jacob, who's going to talk about the video functionality.
Thanks a lot, Hannah, for sharing that. I'm now going to take you through using accuRx to video consult with your patients. So hopefully some of you have had the chance to try this in your patient. With both video and the COVID-19 triaging questionnaire, I would really recommend you just try them out with a dummy patient, with your own mobile, with video, with your mobile and a colleague's mobile, just to see how they work. But we're going to show you that now. So imagine you've got this patient up, Lisa Hobbs, and you want to start a video consultation. We'll go back a step. If you need to let patients know their consultation is going to be by video, we've added some templates to tell the patients that their appointments today will be via video. Please don't come in, and there's another template for appointment tomorrow. So when you want to then start that at the book time, all you need to do is click this video button here, and then the patient's mobile number should pull through. This patient doesn't have one in there, so I'm just going to put in the test number we're using. And then the way this works is we're going to send a link to both the patient on this number and then to your personal phone. The reason we're doing that is because most GP computers don't have webcams or headsets or modern browsers, and so this is going to be, what's most widely available. There is a way of doing a video consultation on your computer if you do have a webcam, and I'll show that to you in a second. And then you also put in your mobile number where you want the link to go to and the phone you're going to use to actually do the consultation. So I'm just going to put that in. Just double checking I've got the right numbers. And your number, once you've entered that, that will be saved here. So when you go and want to contact the next patient, it will already be entered. And if you move computer in the practice or things like that, as long as you're logged into your accuRx account, that mobile number will be remembered there. A lot of people have asked, is that shared with the patient? No, it's not. The patient does not see your mobile number. It's only used so that we can send you a link to start the video consultation. So once those two numbers are in, which they should already both be in there, you can hit send and save. That's going to send this text message to the patient with that link. And then it's also going to send a message to the clinician. So I've just had, as a clinician, if you can see the video feed, this text come through. Dear Dr. Tom Kalman, please click the link to begin the video consultation you sent at 12:46 p.m. And just to show you how that works, I'm just going to click on the link in the message. This is on an iPhone, but it also works on Android. It moves over to video service. You'll need to click request permissions and then allow, and that's for the service to use the camera and microphone in your device, and then just press join meeting. You can see Annie just over on the other side of our office on the patient end, Mrs. Hobbs, who's clicked the link on her end. So that's now available. Because it's on a phone and not on your computer, this also means you can just put it to the side of your desk while you've got Amos full screen and can conduct the consultation via video. It's optimized to run if you've got low internet speeds. It should still run fine. The quality might go down slightly in terms of video quality, but that should still run. I mentioned there being an option if you do have a webcam and microphone on your computer that you can do it directly from there, and that's this link here. So if you do click that on your computer, you'll be taken straight into it on your computer, but you obviously need to have a webcam and microphone or headset to be able to do that. So that's why we've built it optimized for sending to the phone. So that's the demo there. And obviously, as I mentioned, if you were then to open another patient, if I go and open Minnie Mouse, my mobile number is already remembered there, and the patient's mobile number, if it's on the record, will be there. So it should only be 2 clicks to start the appointment. As always, this is a very new feature, and we built it essentially over the weekend. So please do give us any feedback if you have any feedback, so that we can keep making it better. Thanks so much for watching that. I'm now going to move over to questions that you've been sending in. Please do keep sending them in. So first question we've got is, does this work for System 1? So yes, we've been demoing everything on Amos, but this works for both Amos and System 1. We're also working on a standalone version at the moment, which other practices either using Vision or other services the community and hospital could use. But immediately you can use this for both Vision and System 1. How does the video entry look in Amos is one of the questions we had. So if I go back to Lisa Hobbs, who we just had open. You'll see we just show the SMS that was sent with the video link. So you've got an audit trail that was sent. Had a question, can you send photos via SMS? This isn't currently something we support. We have got a team at the moment working on sending documents, so that if you need to send anything from letters you've got to fit notes, that you can send them to patient via SMS as a link, and then they can open that link to access the document. We're hoping to have that out in the next couple of weeks, and that should also help reduce the number of visits from patients into the practice. And in terms of patients sending things in, we are also testing with some practices the ability for patients to respond to messages where you've enabled them to respond. So if that's something you're interested in testing, please let us know. We've had lots of questions relating to GDPR, IG, and security. This is fully GDPR compliant, so the way that the SMS message is sent is exactly the same as our routine SMS messaging. So through Microsoft Azure servers based in England on the NHS Azure, what's called Platform as a Service blueprint, but it follows all the NHS digital guidance on cloud hosting. The video consultation itself isn't recorded, and it's a peer-to-peer connection. So the data is actually flowing directly between your device and the patient, and it's also encrypted. So none of the information from that call, from that video call, is recorded. Obviously, it's quite a new product, so we're in contact with NHSX, who's working to get more clearer guidance out to practice on what they can use. But it is fully compliant with all IG standards, and we do have a template data processing impact assessment, which is available if you contact our support team to view. If that doesn't answer your question on security and GDPR, please do send in more specific questions. Very happy to address them on this call. We've also had a question about us supporting batch messaging. I presume this is to allow patients to message their populations en masse. I know a lot of practices have been using MJOG or iPlato to do that. At the moment, that's not something that we do support. I know we were asked even before, we've been asked quite a lot even before the spread of novel coronavirus. We are considering it. However, we are really trying to focus our effort on new things that practices aren't able to do, such as these video appointments, rather than the things that you should already be able to do with MJOG or iPlato. If that's not the case, and if there are certain things you're not able to do with them, please do let us know, and we'll work out how we can support you in doing that. I had a few questions on cost. So these video consultations for the foreseeable future are completely free. It's a brand new feature. So, when we built it on the weekend, we weren't even sure practices were going to find it useful. Clearly the feedback and the initial usage has shown that they are. But right now, all we're focused on is trying to help as many providers maintain routine services and manage COVID-19. So there's no charge. There isn't going to be a charge for the foreseeable future. We might be able to keep it within the basic free product. The honest, transparent answer is we don't know at the moment. Does this cost the clinician minutes on their plan? Is one of the questions we've had in. So if you're using a personal phone to do the appointment, if you're on a Wi-Fi connection, then it's not going to use any data. It will use the Wi-Fi connection's data, and the SMS is you're just receiving an SMS. If you are on a 4G or 3G or 4G connection, either because you don't have Wi-Fi in your practice or because the connection isn't good enough, then it will use some data. The service we're using is very optimized for low bandwidth connections, so it doesn't use a lot of data, so that should be fine. But if you've got more questions about that, please let us know. It's hard to give an exact amount of data it uses because the call adjusts depending on the speed. So if the internet speed is good, it will be a higher quality call. If it's bad, it will be a lower quality call and use less data. So it's hard to give an exact figure. But the best thing to do is use the practice Wi-Fi if that works for you. You will still need to have some mobile signal in order to receive the SMS message with the link in. So even if you're using the practice Wi-Fi, you'll need some signal to receive that. If you don't have any signal, then you'll need to do it all on your computer and get a webcam, unless you're willing to type out the link manually into your phone, but it's quite a long link to type out. Any feedback around that workflow, using your phone, using your computer, anything like that, please do let us know. Right, other questions we've had. Is this approved via GPSOC? So this is part of the core accuRx product offering that is approved in itself. This video consultation feature we haven't taken to assurance because unfortunately that doesn't move fast enough. We are in talks with NHS Digital and NHS X to fast track that, but all of the assurances we currently have are in place, and practices can use this using those. Can staff use this at home self-isolate? Yes, they can. So if your team starts working from home, either to reduce spread of infection within the team, or for example, because they're looking after their family who can't go into school or work, they can do this from home. Depending on exactly how your remote EMIS setup works, whether they've got a VPN or whether they're remote connecting to their work computer, they can just put in their mobile number as normal, and then conduct the consultation using their mobile phone when they're at home. Just looking for other questions. Can practice pay for data costs for patients/clinicians? We don't expect the data costs to be significant. Obviously, if someone's doing this all day, every day, data usage might increase. Because there's quite a few questions about this, I think we'll go away and try and get a bit clearer data on what's the kind of maximum amount of data that might be used. Obviously, if people are using Wi-Fi, that's not a problem. So we'd strongly recommend doing that. And it's pretty low bandwidth connection, so it shouldn't have any impact on the wider practice internet. But if practices do want to reimburse staff for their data costs on their mobile plans, they're very welcome to. It's not something that we're kind of involved with in any way. We've got a question of what type of phones does this work with? So obviously both the patient and the clinician do need a smartphone. The message that is sent to the patient does say you need internet on your phone, and the template we've made to send patients in advance to let them know that their appointment will be over video does say, if you don't have an internet on your phone, please contact reception, and that gives them an opportunity to let you know. Obviously, if they just can't get through and aren't joining the call, you could give their mobile number a ring and find out. It works very well with Android phones. Any in the sort of last few years work seamlessly. Slightly older ones might be a bit slower, but should be fine. Also works on iPhones. The main thing to note is people on the latest version of what's called iOS, which is the iPhone operating system, will be able to use video calls in the browser. So without downloading an app, they can just click on the link and then choose the browser version. People with iOS 11 and 12, so if they've updated their software, not in the last year, but sort of in the last 3 years, then they'll need to download the Whereby app, and they're taken through that journey when they open the link if they don't have the latest iOS. People with iOS 10 and earlier will need to upgrade their iOS to be able to use this. That's a limitation of any video service. Just older versions of the operating system doesn't support these video technologies. But the vast majority of people, I mean, we haven't hit really any issues and support in terms of people not being able to access that. That obviously applies to both the patient's phone and the clinician's phone. Should I connect via Safari/Chrome or the app? Yep. So as before, if you've got the option to do it in the browser on your phone, then that's very easy. If you're doing lots of these in a day, it might be easier to download the app. To be honest, we haven't got a list of pros and cons yet. So if people try both and have different experiences, please do let us know and we can let practices know. Is it okay for GPs to use their personal phones? Yes, so we built this specifically for that use case. The reason it's okay is we don't send any patient data to the clinician's phone. So if you look at the SMS that's sent to the patient's phone, I'll just read it out again. Did Dr. Tom Kalman click the link to begin the video consultation you sent at 12:46 p.m. And then just a web link with a jumble of characters. So there's no patient data there, and none of the call is recorded or stored on the phone. So it's completely fine to use personal phones. What if the patient loses connection? So they should be able to just click on the link again. That link is valid for 24 hours. But both parties have to click on it at the same time. So if a patient clicks on it and 2 hours and the clinician isn't on the link, then they won't be able to talk to anyone. But while you're in the appointment, they'll just be able to click on that again. Same goes for the clinician. If something like that does happen, you can obviously just fire off a quick SMS to the patient using routine chain SMS to say, I'm still here, try clicking on the link again. We've had some questions from people who can't see the button for video connection or can't see the Florey option for COVID-19 screening. The most likely reason is they're an unapproved user. So when new staff join your team on accuRx, they need to be approved by one of your accuRx admins, and you'll have a notification, red notification, a bit like this on your toolbar if you're one of the admins, that will then have a red dot next to manage practice users. There we are. This is a slightly longer menu than you've probably got because it's a demo version. And if they click on that, they'll be able to approve users. Once they've done that, they should have access to both the video calling and the Florey questionnaires, including the COVID-19 screening. If they still don't, it could be that they need to update accuRx. And the easiest way to do that is to go click on your initials and then click on About, and then there'll be an option to upgrade to the latest version. If they still can't access it, do please contact our support. We've obviously had a huge influx on support, but we've got extra people on to make sure that we can try and get back as quickly as usual. It may be a bit slow, so we do encourage people to check the questions first. Does the link expire? So yes, it will expire after 24 hours. But if it's used within that 24 hours, then both parties need to click on the link to be able to use it. What happens when the patient is waiting for the GP to join? So hopefully, because you as the clinician have just sent this link out, you're ready to go and click on the link immediately. And you should generally get there before the patient and can wait for them to join. If the patient does join, then we've put in the SMS that goes out, you must press the join meeting button and wait for me to connect. So hopefully that lets them know they need to stay there. You can edit the message when you're sending a video consultation. So if you do want to, for example, send these out 5 minutes before when you're typing notes from the previous patient, you can edit this to say, I'll be ready in 5 minutes. Please join that link and wait there. So we've given you that flexibility. Can I use desktop computer with a webcam? Absolutely, yes. So if you've got a webcam on your computer and you've got a microphone, most webcams have a microphone or a headset with a microphone and obviously a speaker, then you can just use your desktop computer. The way to do this is in the example I showed earlier, is once you've sent the message, just to click on the link here, that will open your web browser. It would generally run best on Google Chrome browser. So if you're having issues when you do click on that link, I definitely recommend you just test it internally with a dummy patient before sending out to your patients. If you do have any issues there, I would recommend running that in Chrome. If the link defaults to open in an old version of Internet Explorer, you can either copy the link and paste it into Chrome or make Chrome your default browser. So I think that's all the questions we've had in. There've been lots of them coming in, but we've tried to group them all together. We'll make sure that the main things here are covered in the Q&A and support section on our website. If things aren't covered in that Q&A, please do let us know. Just a few more have come in while I've been answering those. So, what if patients are not able to communicate by video? Can they decline the video? So yeah, if a patient doesn't want to participate in the call, they just don't click on the link. We have made a template. I don't think it will be on the templates I've got here. Yep, they are here actually. So we've made a template that you can send out before the appointment. So for example, if I had an appointment this afternoon that I wanted to take place over video, I could send a patient this normal SMS message saying, oh, I just clicked off it, sorry. saying your appointment today will take place via video call. Please don't come into the practice. We'll send you a message with instructions when we're ready for your appointment to begin. This will be at the same time or soon after your booking, so please make sure you're somewhere quiet with phone signal and keep an eye on your phone. If you don't have a smartphone, please call us. So that's given the patient the opportunity to contact reception. Obviously, you can make your own templates as normal if you want to send a different message to people. And yes, you can edit the reply as people have asked. I'm just looking through. There isn't a virtual waiting room, and that's because we send the link to specific patients. I saw a question about is this covered by the MDU? So we're following the guidance that's been given by NHS Digital. It's a bit out of date, so and that's why we're working with them to try and get more up-to-date information. We haven't yet spoken to the medical defence organisations. The main thing we'd say is there is not really any difference in using a video consultation to using a phone call. It's a one-off connection that's peer-to-peer, goes through the internet. Most practices will be on a VoIP connection and isn't recorded. And here you've also got a visual verification of someone's identity and a record that goes in the notes that that call took place. So it's not really any different from that perspective to using a phone call. Just going to skim through. Check any others. Group consultations via video. So you could, if you wanted to do a group consultation, the link that you sent to a patient, you could copy and then paste into an SMS and send to other patients, and that will work. We don't recommend doing that to above 4 people, but you can, yeah, you are able to do that. Can the patient record the consultation without the clinician's knowledge? So there's nowhere in our software to do that. Obviously, if a patient wants to record the screen on their phone or take a screenshot, they could do that, but that's much the same as they could take a dictaphone into an appointment and record it. So there's nothing built into the software that allows them to do that. I think that covers the main questions. Were there any others?
Yeah, I can just say that there are some that require more specific instructions.
Got it. So yeah, some of the questions needed, I don't know if you heard Annie, but more specific instructions. So do please visit the support section on our website. We have had hundreds come in. So yeah, the ones I flashed through are, a selection of them. So if we haven't answered yours, sorry, but please do send it to our support team. We'll make sure we cover it or get it on our website. But hopefully that's given practices an idea of how to use both those features. The recording of this webinar will make available on our YouTube channel, so you can share it with colleagues. For any other questions, please just contact our support team. As usual, you can chat through the web to us or send us an email. And probably the best place to stay up to date, particularly with what other practices are doing and how other practices are using us, is the accuRx chain community on Facebook. So if you join that, there are quite a few discussions going on between practices around how they're implementing this. And it's also where we keep people most up to date with what we're working on, because we want to avoid sending loads of emails. So if you do have any questions about that, visit there. Do we have any questions about the triaging, or were they mostly about video?
Mostly about video.
Fine. So yeah, if you do also have any questions about the COVID-19 triaging, please let us know. Just one thing to say on that is it doesn't make any decisions. So we made the decision not to say that whether a person is at risk or not. And that's because the guidance from NHS England and Public Health England is so rapidly changing. If the guidance does change to include new questions, we'll make sure to include those as soon as possible. And we are in contact with NHSX and NHS England to try and get a head start on that. But if the guidance in terms of locations people have visited change, that should be fine. Well, that is fine, because we're just asking people where they've been in the last 2 weeks. So what you'll need to do is just keep your reception teams up to date on the guidance in terms of which patients to flag and which patients to let know not to come in. If you do, sorry, which patients to let know to come in. And we have also made an SMS template that if you do get a message from someone, a response from someone with the screening questionnaire, you can quickly send them a message to say, thanks for completing it, we've reviewed it, and we're happy for you to come into the practice. Obviously, if you're not happy, it probably does warrant a phone call to discuss that in more detail from the duty doctor or one of your team. Great. Thanks so much for joining, everyone. We know it was quite short notice, but we're really keen to help practice get set up. As I've said already, if you do have any questions, let us know. But have a good afternoon, and do let us know if you think there are any other ways that we can be helping you. Thank you very much.